In order to test active range of motion of the lumbar spine, so you'd have the patient with the hands on their knees and have them slide down their hands as far as they go towards their toes. This is flexion of the lumbar spine. And then for extension, you'd be standing laterally or behind, and you'd have the patient have their hands on their hips, and then you want them to extend backwards. Side flexion, you'd have them standing and their hands on the outside of their thighs, and you want them to slide each hand down their thighs opposite ways. In order to test active range of motion of the thoracic spine, you want them seated, and you want the patient to cross their arms along to their shoulders, and you want them to hunch their back, which tests flexion. Test extension, have their arms crossed along their forehead and then fully extend backwards. And in order to test rotation, you want their arms crossed against their shoulders once again, and you want the patient to twist side to side. And then in order to test side flexion, you'd want the patient to move side to side. Then in order to test active range of motion of the cervical spine, you want them to look up at the ceiling for extension. And then for flexion, you'd want your patient to look down as far as possible. You then want to test rotation, so you want the patient to move head side to side. And then you would test side flexion, and you'd ask the patient to move the head side to side without rotating, sorry.